Hello and thank you for tuning in to Thrive and Shine, your guide to optimal wellness, a channel dedicated to providing healthy lifestyle tips to be the best version of ourselves. In this video, I will discuss the 4 phases of spinal disc degeneration and how they affect overall well-being and quality of life. We will also provide important insight into how we can prevent, manage, control, and reduce the progression of disc degeneration and maintain spinal health. We will also discuss how our lives can be negatively affected by each of the phases of disc and joint degeneration. I'm excited, so let's get started. Spinal and disc degeneration is a progressive condition that typically unfolds in 4 distinct phases, each characterized by specific changes in the spine's structure and function. Phase 1, dysfunction. During this initial phase, the spinal discs begin to lose their hydration and elasticity. This loss of water content leads to reduced disc height and flexibility, resulting in increased stress on surrounding structures. Patients may experience mild discomfort, such as stiffness or occasional pain, especially after periods of inactivity. This phase is often associated with minor postural changes and muscle imbalances. Phase 1 of disc degeneration, often referred to as dysfunction, marks the early stages of changes occurring in the spinal discs and surrounding structures. During this phase, the intervertebral discs begin to lose hydration and elasticity, which are essential for maintaining their function as shock absorbers and stabilizers of the spine. This loss of water content leads to a decrease in disc height, resulting in reduced flexibility and resilience. In phase 1, the symptoms may be subtle, often presenting as mild discomfort, stiffness, or periodic pain, particularly after inactivity or prolonged sitting. Early interventions such as physical therapy, lifestyle modifications, and ergonomic adjustments can be crucial in managing symptoms and preventing progression to more advanced stages of degeneration. The initial phase, known as dysfunction, is often triggered by a combination of genetic predisposition and lifestyle factors. Over time, normal wear and tear from daily activities, repetitive motions, or heavy lifting can lead to microtrauma in the spinal discs. Factors such as poor posture, obesity, and lack of physical activity can exacerbate this deterioration, resulting in decreased hydration and loss of elasticity within the discs. Phase 2, instability. As degeneration continues, the spine's stability can start to diminish. The weakened discs are unable to adequately support the vertebrae, leading to micro-movements and potential instability in the spinal column. This phase may manifest as more pronounced pain that can radiate to nearby areas and may include muscle spasms as the body attempts to compensate for the instability. Diagnosis might include imaging studies showing minor misalignments or disc bulging. Phase 2 of disc degeneration is characterized by increased instability in the spinal segments, primarily as a result of ongoing changes to the intervertebral discs and surrounding structures. At this stage, the initial biochemical alterations from phase 1 progress, leading to notable structural changes in the disc itself. The loss of proteoglycans continues to affect the disc's ability to retain water. Consequently, discs become dehydrated and lose height. As the discs degenerate, the surrounding ligaments and muscles are impaired, leading to an imbalance in spinal support. This instability can manifest as increased mobility between adjacent vertebrae, which may contribute to abnormal motion patterns during daily activities or physical exertion. Patients may start to experience symptoms such as localized pain, stiffness, or discomfort, often exacerbated by certain movements or positions. Additionally, the altered mechanics of the spine can lead to compensatory changes in posture and gait, potentially affecting overall mobility and function. In some cases, this phase may also involve the formation of bone spurs or osteophytes as the body attempts to stabilize the affected segments, further complicating the clinical picture. Overall, Phase 2 instability highlights the progressive nature of disc degeneration and its impact on spinal health and mobility. In the second phase, dehydration, the intervertebral discs continue to lose water content due to reduced proteoglycan synthesis. This natural process can be accelerated by age, as the body's ability to maintain fluid levels diminishes. Additionally, factors like chronic inflammation and inadequate blood supply may contribute to the degeneration of the disc, leading to further loss of height and elasticity. Phase 3, dysfunctional stabilization and deterioration. In this phase, the body attempts to stabilize the spine through various compensatory mechanisms, such as the formation of bone spurs or the worsening degeneration of the discs and joints. While these adaptations may temporarily alleviate symptoms, they often lead to further restrictions in movement and chronic pain. The affected individual might experience increased difficulty with daily activities, and the range of motion in the spine can become noticeably limited. In phase 3 of disc degeneration, the condition reaches a stage where stabilization occurs despite the ongoing degeneration of the intervertebral discs. At this point, significant structural changes have taken place, including further loss of disc height and hydration, leading to reduced disc function. However, the body adapts to these changes through various compensatory mechanisms. During this phase, the spinal joints may undergo changes such as the development of osteophytes, bone spurs, and joint remodeling. These adaptations can create a form of stability in the spine, even as the discs continue to degenerate. While this stabilization may initially alleviate some symptoms, it can also lead to a new set of challenges, including altered biomechanics and strain on surrounding structures. Patients in phase 3 may experience chronic pain and stiffness as the spinal stability relies heavily on adjacent vertebrae and their supportive structures. Muscle guarding and tension often arise as the body attempts to protect the compromised area, potentially leading to decreased mobility. The presence of inflammation may also contribute to discomfort, particularly during movement or prolonged inactivity. While some individuals find relief in this phase due to the established stabilization, others may still navigate a complex landscape of symptoms and functional limitations. Physical therapy and rehabilitative exercises can play a crucial role in managing pain and enhancing mobility by strengthening surrounding muscles and improving overall spinal function. Ultimately, phase 3 represents a critical juncture in the degeneration process, where the spine has adapted to instability, but ongoing care and management are essential for maintaining quality of life. Phase 3 is characterized by significant structural changes in the discs. As the discs become more dehydrated, they can develop fissures and tears in the outer annulus. These changes are often exacerbated by mechanical stresses such as improper lifting techniques and high-impact activities. The presence of inflammation and the body's attempt to heal can lead to the formation of osteophytes, bone spurs, and decreased mobility in the affected area. Phase 4. Structural failure. In the final phase, significant structural changes occur, including severe disc herniation, advanced osteoarthritis, and possible spinal deformities like scoliosis or stenosis. Pain becomes more pervasive and can often be debilitating, significantly impacting quality of life. At this stage, conservative treatments might be less effective, and surgical intervention may be considered to relieve pressure on spinal nerves or restore stability. Phase 4 of disc degeneration signifies a critical stage characterized by substantial structural failure of the intervertebral discs and the surrounding spinal architecture. By this phase, the cumulative effects of degeneration have led to significant loss of disc height and integrity, resulting in an inability of the discs to absorb shock and maintain spinal alignment effectively. In this phase, the disc may exhibit severe degradation, including fissures in the annulus fibrosus, the outer layer of the disc, and a substantial reduction in the proteoglycan and water content. The loss of disc material compromises its mechanical properties, leading to increased stress on adjacent vertebrae and promoting further degeneration. As a result, the vertebrae may develop abnormal movements that can cause instability and pain. Additionally, phase 4 is often associated with the development of complications such as herniated discs, where the inner nucleus pulposus protrudes through tears in the outer annulus, potentially impinging on nearby nerve roots. This can lead to radicular symptoms including radiating pain, numbness, or weakness in the limbs depending on the affected nerve. Patients in this stage typically experience chronic and debilitating pain, significantly impacting their daily activities and quality of life. Mobility may be severely restricted and conservative treatments may provide limited relief. In some cases, surgical interventions such as discectomy or spinal fusion may be considered to alleviate pain and restore stability to the affected segments. Overall, phase 4 of disc degeneration represents a point of significant clinical concern, necessitating comprehensive assessment and management strategies to address the complex interplay of pain, dysfunction, and structural failure in the spinal column. Finally, in phase 4, the body attempts to compensate for the damaged discs by stabilizing the affected vertebral segments. This may include the formation of scar tissue, changes in surrounding muscles, and alterations in spinal mechanics. Though the structural integrity of the spine may not fully return to its original state, this phase can provide some level of stability. However, it may also lead to the development of adjacent segment disease, as other discs or joints may bear the additional load and stress. Prevention strategies. Regular exercise. Engaging in low-impact activities such as swimming, walking, or cycling helps strengthen the muscles surrounding the spine, improving its stability and flexibility. Proper posture. Maintaining good posture while sitting, standing, or lifting can reduce stress on the spinal discs, minimizing the risk of degeneration. Ergonomic adjustments. Using ergonomic furniture and tools, especially in a work setting, can help ensure that the spine is supported appropriately, reducing the chance of injury. Healthy weight management. Maintaining a healthy weight helps reduce the load on the spine, decreasing wear and tear on the discs. Diet and hydration. A balanced diet rich in vitamins and minerals supports overall disc health. Staying hydrated is also crucial as the discs in the spine rely on adequate fluid to maintain their shape and function. Treatment strategies. Chiropractic care. Chiropractors can perform spinal adjustments that may relieve pain and improve spinal function. Restoring proper function of vertebrae that aren't aligned or moving properly, known as subluxations, helps the body adapt to the stresses of our daily lives that lead to degeneration. Adequate chiropractic care plays a crucial role in preventing, managing, and slowing spinal disc degeneration. By focusing on spinal alignment and overall musculoskeletal health, chiropractors can help maintain optimal function and mobility of the spine. Regular adjustments alleviate pressure on spinal structures, promoting better circulation and increased hydration in the intervertebral discs, which can slow the degenerative process. Additionally, chiropractic care includes personalized exercise regimens and lifestyle modifications that strengthen the supporting muscles and improve posture, reducing the risk of further degeneration. Patient education on ergonomic practices and injury prevention also helps individuals make informed choices that protect their spinal health. Through early intervention and ongoing care, chiropractic approaches can effectively manage symptoms, enhance quality of life, and help prevent the progression of disc degeneration. Physical therapy. A physical therapist can develop a personalized exercise program to strengthen back muscles and improve flexibility, helping alleviate pain and discomfort. Medications, injections, and surgery should be considered a last resort for patients experiencing pain from spinal disc and joint degeneration. These interventions often come with potential side effects, risks, and complications, which can impact overall health and quality of life. First-line treatments such as chiropractic care, physical therapy, and lifestyle modifications prioritize non-invasive approaches aimed at improving function and alleviating pain through natural means. By exploring conservative options and focusing on strengthening the musculoskeletal system, patients can often find relief without the need for more aggressive treatments. Only if these non-invasive methods prove insufficient should medications, injections, or surgical interventions be contemplated, ensuring a more holistic and measured approach to managing spinal health. Medications, over-the-counter pain relievers like NSAIDs, can help manage pain and inflammation. In some cases, doctors may prescribe stronger medications or muscle relaxants. Injections. Corticosteroid injections can be used to reduce inflammation and relieve pain in specific areas. Surgery. In severe cases where conservative treatments fail, surgical options such as discectomy or spinal fusion may be necessary to alleviate symptoms and restore function. In conclusion, understanding these phases is crucial for early detection and intervention, which can help manage symptoms and improve overall spinal health. For optimum nervous system function, it is important to manage, control, and slow these phases, and the development of effective prevention and treatment strategies for disc degeneration. Disc degeneration is a common issue that can lead to back pain and other complications. Effective prevention and treatment strategies are crucial for managing this condition. Incorporating preventive measures and seeking appropriate treatment can significantly improve outcomes for those facing disc degeneration, leading to a more active and pain-free life. Thank you so much for watching. I hope this information helps. If you found this video enjoyable, informative, and helpful, Please share, like, subscribe, and turn on your notification bell so you get notified about all the lifestyle tips and tricks to get better faster and stay better longer. Along with this information about disc degeneration, I have other great videos on health and well-being. The 5 factors of health, how they impact our health. This video covers information on diet, exercise, rest, positive mental attitude, and optimal functioning nervous system. Daily stress. What's really affecting your health? It covers the 3 daily stresses that affect our health, explaining the importance of identifying, reducing, and managing chemical, emotional, and physical stress in our daily lives. Thank you again for watching, and remember, keep thriving and shining.